The topic is chlamydia. Chlamydia is a sexually transmitted infection. It is a bacteria that can affect both men and women. There are about 4 million cases or people who develop chlamydia in the United States every year. Chlamydia and gonorrhea can cause similar signs and symptoms, including discharge from the penis, vagina, pharyngeal, and pain with urination. Chlamydia usually causes no symptoms. Chlamydia can cause long-term consequences or complications in both women and men, especially if they are not treated. Chlamydia is a curable infection. Chlamydia is an infection that is caused by a bacteria, Chlamydia trachomatis, which can affect the genital tract and rectal tract and pharyngeal tract of women and men. The infection spreads through sexual intimate contact. A man does not need to ejaculate to spread the infection. Women can have rectal infection even if they do not practice anal sex, because chlamydia can also spread to the rectum from infected vaginal secretions. Insertive sex toys or objects may also spread chlamydia when shared between people. It is not possible to be infected with chlamydia by touching an object, like a toilet seat. The risk of getting chlamydia increases when the person has more than one sexual partner, has unprotected sexual activity. Chlamydia infections may cause no symptoms, mild symptoms, severe symptoms. Most people do not have symptoms, and they will only find out if they have the infection once they get tested. So it is easy to spread the infection. Up to 90% of women with chlamydia have no symptoms at all. However, if the person develops symptoms, it will be vaginal discharge, abnormal vaginal bleeding, abdominal pain, pain during sex, burning or pain with urination. Up to 70% of men with chlamydia have no symptoms. However, if they develop symptoms, it will be burning or pain with urination, discharge from the penis, pain or tenderness in the testicles, swelling of the scrotum. Women and men who have sex with men can develop chlamydia infection in the rectum or anus. Some people with chlamydia may develop reactive arthritis, which can include joint pain, and uveitis, which is an inflammation of the inner part of the eye. Chlamydia can also cause conjunctivitis. This happens when there has been exposure of genital secretions from a person infected with bacteria. Testing for chlamydia can be done at home, self-collected, and sent to a laboratory for testing. They are not always accurate. Tests can be also performed at a doctor's office. It could be a urine sample, a swab of the vagina, cervix, pharyngeal or rectal anal area, also urethra in males. Once yearly screening is recommended for all sexually active women younger than 25 years old, even if no symptoms are present. For older women, once a year testing could be recommended if they have a higher likelihood of exposure. For example, a new sex partner or more than one sex partner. At least once a year screening is recommended for men who have sex with men. Testing should include both urine and rectal. If someone is diagnosed with a sexually transmitted infection like chlamydia or others, people should also be tested then for HIV, gonorrhea, syphilis, trichomonas, and other infections. People should be vaccinated against hepatitis B, hepatitis A, HPV. Chlamydia in women can lead to PID or pelvic inflammatory disease. If chlamydia is not treated, about 30% of women could develop PID. PID can cause scarring of the fallopian tubes, which can lead to infertility and increased risk of ectopic pregnancy. Also, chronic pelvic pain. If someone develops chlamydia during pregnancy, chlamydia could cause miscarriage or premature birth if untreated. The baby can also acquire the infection from the pregnant mother during delivery. It can cause the baby to develop conjunctivitis, among other complications, like pneumonia, among others. Chlamydia can be cured. It can be treated. There are several treatments available for chlamydia. The person should always discuss with the doctor what would be the best treatment for that particular person. There is also prevention treatment available. Some of the antibiotics that can be used to treat chlamydia include doxycycline, azithromycin, among other antibiotics. If the person has been sexually active with other people within 60 days of infection, treatment is important for the person who has the infection and anyone who the person has been sexually active with within 60 days, even if the person has no symptoms. So sexual partners should be treated. The person should not be sexually active until 1 week passes after both the person and the partner has been treated or have completed treatment. Testing should be repeated 1 to 3 months after initial infection to make sure it is gone, and also to make sure that there is not a new infection. Recurrence is possible, or reinfection is possible. There is no doxy-PEP or prevention treatment or post-exposure prophylaxis treatment to prevent chlamydia and other sexually transmitted infections. Other ways to prevent infection besides medication after exposure includes condom use. Do not have sexual activity if the partner has any symptoms, such as discharge, burning, or other. I hope this was helpful. Thank you.